this article for symptom modification. So we'll kind of go into symptom modifications for shoulder pain. So say they have pain raising their shoulder and it just hurts every single time. There's a few things you can play with. You can increase thoracic flexion, sometimes, rarely, but that might cause reduction of symptoms. More often, retraction and thoracic extension and have them flex will reduce their symptoms. And you're looking for 80% reduction in their symptoms. So you can do that. You can also mess with the elevation of their shoulders. So you can hold their shoulder protracted, retracted, elevated, and then have them do the motion. And whatever gives them 80% symptom reduction, that's what you're gonna have them do while they do the motion. But the most common way that they can reduce their pain is to get their external rotators firing, because a lot of times they need to be firing in order to do elevation of the glenohumeral joint. So if they're not working properly, this forces them to activate while they do the flexion motion. And if they just want to start in just this small amount and just get to about 90 degrees flexion, as long as it's reduced by like 80% and they feel comfortable doing that, then they can progress. So it's pushing out against the band, keep the elbows slightly bent. They progress it by creating more torque, so they'll push out, keeping the elbows straight, and then they can raise overhead all the way while maintaining external rotation, pushing out against the band the whole time. And then something else you can do with symptom modification, you can also do a P to A mobilization of the glenoid, or of the humeral head. You can also do a A to P glide of the humeral head too, to see if that reduces their symptoms. And if that helps, that's the case where you use the jump stretch bands. And then, so say the A to P reduces their symptoms, they're gonna take the band, they're gonna come right across, right off of the acromion process. So right about there, take all the slack out, so that it's forcing their humeral head back a little bit, and then they're gonna elevate their shoulder, just like that. So it should feel, again, you're looking for that 80% reduction in symptoms, and it's pulling that humeral head back so it doesn't tilt forward, and then it can clear a lot of those pain-producing structures that way. And then they can also do that same idea. If they respond better to a P to A force, they'll come back, and then they'll be able to do that flexion. And it should be right on the back of the humeral head with that too. So I'm trying to do it on this side. So here's my acromion process right here. Here's my humeral head, and then I'm raising my arm up. You can go into scaption, you can do abduction, you can do straight flexion, but the goal is to pull the humeral head that way while you do the motion.